Many know Hippocrates to be the father of medicine, as he diverged away from religious explanations for disease and focused on natural explanations instead. Hippocrates laid the foundation of medicine with various ethics and practices, but categorized women as inferior and labeled those who presented their symptoms as hysterical. Aristotle, another ancient Greek contributor to science, termed women's bodies as mutilated male bodies. These misconceptions, placed early in medicine's beginnings, shaped medical research into a form that disregards women's well-being.
This system of healthcare that has grown and persisted since ancient Greek times has led to women being called dramatic, instances of misdiagnosis in women's healthcare visits, as well as an unfortunate lack of disrespect based on female patients' race. Hello, my name is Miranda, and if you have a passion for healthcare like I do, it's nearly impossible to have never heard this story before. But you also may be wondering, where is this conversation going? I am a college student who is working this semester on researching the neglect that women face in healthcare and its impacts. However, I understand that every discussion has multiple viewpoints, and I believe that every viewpoint deserves to be heard out fully. Some may argue that neglect in women's healthcare is a persisting issue. However, the idea that healthcare is going to be more attentive to women is also a correct statement because of increasing number of women working in healthcare, growing participation of women in medical research, and the elimination of disrespect based on race, which is all important because these changes contribute greatly to the inclusion of women's experiences. The point that I discussed in my initial essay was that women often encounter being labeled as dramatic when talking about their symptoms to professionals in healthcare. However, since there are increasing numbers of women working in the healthcare field, it is more likely that women will be heard and less likely that they will be accused of malingering. The NIH, or National Institute of Health, is a U.S. government office that has dedicated 30 years to researching the impacts of women's healthcare as well as documenting it. An NIH article called The History of Women's Participation in Clinical Research highlights that Dr. Bernadine Healy became the first female NIH director and launched the Women's Health Initiative, a set of clinical trials and an observational study that together enrolled more than 150,000 postmenopausal women over the period of 15 years. This employment of Dr. Healy in the NIH served as a huge sigh of relief for women around the United States as they began to understand that their voices and experiences would be heard. This monumental moment was important in bringing forward the variation of symptoms that women experience and lessening the likelihood that women are accused of over-exaggerating. Along with being accused of over-exaggerating, women oftentimes experience being misdiagnosed. However, growing participation of women in healthcare research aids in reducing misdiagnosis. In the same NIH article referenced earlier, they explained that Congress wrote its inclusion policy into federal law through a section in the NIH Revitalization Act in 1993. This ensured by several means that women and minorities are all included in clinical research. This law essentially mandated that cost could not be used as an excuse as to why clinical trials do not include women and minorities, and it also supported outreach efforts to gather more women to take part in trials. The reason I bring this article up and the new law that they placed is because increased efforts in researching symptoms in women makes it more likely that women will be correctly diagnosed in an efficient time where their symptoms don't lead to more dangerous outcomes. So far, it's very obvious that we are making advances in recognizing how symptoms differ in women from men and stemming away from the androcentric research that has been implemented over the years. The last topic that I mentioned in my initial essay is that women experience discrimination and disrespect based solely on their race, and unfortunately, the majority of these women who are experiencing these negative encounters are African American women. So, a disclaimer before I speak on this topic: I know and understand that I am not a part of this community, and it is not my spot, my place to speak for anybody in this community. I just want to explain the research that I have done and have no means of speaking for a community that I am not a part of. Fortunately, many attempts are being made currently to eliminate disrespect and disregard that revolves around race. Two authors for the Commonwealth Fund, Martha Hofstadter and Sarah Klein, wrote an article that researches racism in healthcare settings and goes to several institutions to find ways in which they are trying to eliminate this racism. Hofstadter and Klein state academic medical centers are developing tools such as equity scorecards and real-time reporting systems to identify racism. A center in specific that is training to adjust racism is UCLA, which allows patients to identify themselves rather than relying on staff to take their best guess. And Penn State also gives voice to patients and staff as they encourage them to recognize and report racism. So, on a plus side in these advancements is that they mitigate the racism that patients encounter whenever they're having their healthcare visits, and it also creates consequences for healthcare professionals who demonstrate racism towards a patient. So, in conclusion, while I do still stand by my initial argument that neglect against women in healthcare is a persisting issue, I do also understand and recognize that there are insane advancements and measures being taken to better the experiences of women in healthcare, and in ways that the women who were deemed hysterical in ancient Greek time would have never imagined. Today's system of healthcare has overall grown to be more inclusive, especially through laws that include women in healthcare clinical trials, training practices that work to eliminate racial bias, and higher numbers of women working in the healthcare system. If you have any questions, feel free to ask, and I appreciate you listening to my discussion.
You didn't think the video was really over, did you? Now for a quick word from our ad sponsor.
Feeling out of balance and needing a boost? Try our Women's Probiotic Plus Prebiotic Plus Vitamin Supplement with great benefits of supporting digestive health, boosting energy, antioxidant agents, reduced risk of cancer, and reduced acne. Our product is your all-encompassing solution to your life's worst problems. Our product is guaranteed to give instant results and is approved by TikTok and Instagram fitness influencers worldwide. This is not a real product. Please do research before buying supplements from random videos with exaggerated benefits.